And welcome to Ask the Expert. From medical questions to questions about surgery or just debunking myths, there are numerous medical questions we've set out to answer for you. For the past several years, 7 News, in partnership with Bon Secours St. has been getting answers to your questions. From the simple questions like how to get better sleep to the more complicated ones concerning cancer and screenings. This is 7 News' Ask the Expert. Let's take a look.
We've all heard the saying, old habits are hard to break. Psychiatrist Dr. Carson Felkel compares it to driving on a rough dirt road.
If you try to get out of the rut, it can be very hard because your car just gets pulled back in. We all have these automatic behaviors that suck us back into 50% of our day.
To break an old habit and form a new behavior, Dr. Felkel says you really have to get out of that rut.
And this takes creating small incremental changes and being consistent with your behavior change.
He says it's important to be realistic with your goals.
I think it's really important to set goals. They can be fun. They can show that anyone can adapt and improve their life. Maybe for the new year, that might mean getting more steps or exercise, losing some weight. But make sure you set goals that are obtainable. Give yourself a lot of praise for finding those incremental improvements, and you'll see your behavior change.
When you feel like you want to quit, having accountability can help you stick with your resolution.
Every habit is so different depending on whether it's something small or large, easy or hard, but whenever you can find accountability in people that really know you well, that probably is going to improve your chances of a success.
If you feel like you need a bigger support system, reach out to a professional.
Therapy, coaching, seeing a psychiatrist or primary care provider can really help because it helps you to become more self-aware and identify what those automatic behaviors are so that you can change them.
Let's think about probiotics as our healthy, beneficial bacteria.
In our gastrointestinal system, we have microorganisms, both good ones and the bad ones. Registered dietitian Jalek Patel says probiotics are the good ones, the healthy, beneficial bacteria which have been shown to help support good health.
We've learned that probiotics support the immune system. We also know that probiotics support food digestion and medication digestion. We also know that probiotics support us in not only producing certain vitamins like vitamin B and vitamin K, but also mineral absorption as well. We also are finding that probiotics support mood and general health.
Patel says probiotics come in different forms.
We get them naturally in some of our foods. We also will have probiotics added into foods, so we're starting to see it in baby foods. We also are, seeing it in some of our beverages that we're drinking now, and then we can also get them over the counter as a dietary supplement.
Patel urges caution before reaching for a supplement.
These supplements that we are consuming are not regulated by the FDA like your medications are. So we're not sure if the amount of probiotic strains that are in some of these dietary supplements are truly in fact in there. And what we also don't know is, are those the strains that your body needs? Because we're so individual.
Instead, she recommends consuming probiotics in their most natural form.
Certain foods provide us that natural probiotic. That includes our fermented foods such as sauerkraut, natural fermented sauerkraut, yogurt, kefir, kombucha has become very popular, miso. These are great fermented foods. Pickles, pickled vegetables, if you like them, those are great forms of natural probiotics that we can just include in our day-to-day diet.
A lot of people are affected by afternoon slump or feeling tired.
When the afternoon sleepiness hits, a jolt of caffeine may seem like a solution, but family medicine physician Dr. Sanjana Adia Dinesh says not so quick.
I wouldn't recommend anything late in the day because caffeine usually lasts. The half-life of a caffeine is like 3 to 5 hours. So if you take something late in the afternoon, it's going to affect your sleep at night significantly.
Not only can caffeine late in the day make it difficult for you to fall asleep at night, but it can also make it difficult to stay asleep.
You will wake up multiple times because of the caffeine intake that happened later in the day.
Instead of reaching for that extra cup of coffee, soda, or energy drink, Dr. Adia Danish says try this.
I would always recommend everyone to drink at least 2 liters of water a day. So drinking that throughout the day will be very beneficial in keeping the body very hydrated, and hydration helps every part of the body and the cells, so it helps the brain, keeping you awake and alert through the day.
Also, eating multiple meals throughout the workday versus a heavy meal during lunch can help ward off an afternoon slump. Dr. Adia Dinesh says snack wisely.
A proper snack would be something that's very balanced, that has some amount of carbohydrates, proteins, and nutrients in it. So examples would be like a Greek yogurt with berries, oatmeal with fruits and nuts, like just a packet of nuts, bananas with peanut butter, veggies with hummus, something like that.
She says don't forget to move your body.
Even if you don't have time, you're sitting and working for a long time, just taking brief time to just do stretching exercises, that also helps because it increases blood circulation to the brain when you do that, and that helps with staying awake and keeping yourself alert.
If you can, take a quick nap.
So a cat nap or a power nap it has to be short, not too long. So basically 10 to 20 minutes is a usual time frame that would be beneficial for the body.
Remember, you can find all of these stories on our website, WSPA.com. Just click on the Ask the Experts section. Right now, we're going to take a quick break and return with answers to more of your medical questions. We want to continue now with a look at doctors and health experts answering your questions. This is 7 News Ask the Expert in partnership with Bon Secours St. Francis. Taking care of your cervix is a vital part of women's overall health, and medical professionals say it starts with screenings.
In the past 30 years in the United States, since we've actually standardized cervical cancer screening, we've been able to reduce the rates of cervical cancer by half.
Kelly Breyer San Miguel is an OB/GYN at Bon Secours who sees a number of patients each week at Carolina Women's Health.
Generally, patients come to see us about once a year for an annual exam. Part of that annual exam will include a pap smear, which is testing for cervical cytology, as well as, depending on their age, also testing for the human papillomavirus or HPV.
According to the World Health Organization, 99% of all cervical cancer cases are linked to infection with high-risk human papillomavirus, also known as HPV.
The HPV virus is actually the most common sexually transmitted infection in the United States. They say the prevalence is up to like 20 million.
Although most infections with HPV resolve on their own, doctors say recurring infections can lead to cancer in women.
The treatment can change, so usually that's a kind of the shared decision making when you get this pathology back with your provider to decide what's the best thing. The whole goal of both of these procedures is to remove what's abnormal and to then let your body's natural immune system to help kind of fight what's left of the virus.
The good news, doctors say cervical cancer is one of the most treatable forms of cancer in women. That is, as long as it's managed effectively, according to the World Health Organization. Experts advise you to be informed, get screened regularly, and get vaccinated to reduce your risk of contracting viral illnesses.
It can't be prevented, so we actually now have a vaccine. It's called the HPV vaccine or the Gardasil vaccine.
If you're considering ways to maintain cervical health, including preventative vaccines, speak with your OB/GYN or a primary care doctor to discuss available options. For this week's Ask the Expert, I'm Kelsey O'Donnell. Your body best, and when you have unexplained pain, specifically in your chest, concerns may arise.
We always consider chest pain as an important symptom.
Dr. Gretchen Kneb, a physician at Bon Secours, has been a resource for many people in the upstate, helping to break down the different causes of chest pain.
First of all, I have to look at the chest pain, how long it's lasting. If it's lasting a long time and it's sitting there on your chest and it feels like somebody's sitting on your chest, that could be cardiac in nature. If the pain goes away very quickly, or if you move suddenly and that chest pain is there, it's unlikely that it is caused by a heart attack. or heart pain.
Doctors say some symptoms may be less serious than others. However, discomfort in your chest is always a reason to seek immediate medical attention, especially if you're dizzy, have pain throughout other parts of your body, or experience shortness of breath.
Chest pain, that is a pressure pain that feels like an elephant sitting on your chest. It's a squeezing pain. Those are all concerning for cardiac. If the pain is in your neck, if it's in your shoulder, if it's going up into your jaw, if it's related with shortness of breath, if you're sweating at the time, if you have nausea, if you have vomiting, those are all symptoms that would be very concerning. And that's the time when you need to call 911 or go to the ER.
While some discomfort may suggest a serious heart condition, Dr. Kaneb says that's not always the case.
In most cases, chest pain won't be a heart attack. A lot of people come in with chest pain and it may be reflux, and it may be a burning pain that they come in with, and that differentiates it for us from being a heart attack.
Medical professionals say there are other factors that can cause chest discomfort, including but not limited to increased stress, recent changes to your exercise routine, or even a common cold. Regardless of what you think it could be, doctors say you should always seek professional help because pain in one area of your body could be an underlying factor for a condition elsewhere.
Anytime you are concerned about your chest pain, please call your primary care doctor and we can go over those symptoms with you that you're having.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Excess belly fat does more than just make it hard to zip up your favorite pair of pants.
So belly fat is dangerous.
Bon Secours bariatric surgeon Dr. Jessica Gonzalez Hernandez says it comes with serious health risks too.
They call belly fat, but because your belly can be big, but not because of the only external fat that you see, but also the fat that is inside surrounding your liver, your intestines, even your heart. Is the fat that's surrounding your organs on the inside.
According to the Mayo Clinic, people who regularly eat and drink more calories than they burn in a day are more likely to gain extra weight, especially in the abdominal region. Doctors say if it's not taken seriously, belly fat can lead to a number of problems.
Excess abdominal fat or excess visceral fat can increase your risk of developing multiple medical problems like diabetes, having a heart attack, stroke, fatty liver, end-stage liver disease, and many others.
With that being said, there are some ways to improve your well-being and decrease the risk of living with one of those health complications.
Do at least 300 minutes of moderate physical activity every week. Have a healthy diet. Sleep enough. Avoid the ingestion of sugary drinks and avoid smoking.
Doctors say losing belly fat doesn't happen overnight. It takes effort and patience. But if you've tried every recommendation and are still having trouble shedding the extra pounds, medical professionals say there could be other underlying issues.
Any abnormalities with certain hormones like insulin, cortisol, estrogen, and testosterone can influence where the body stores the fat.
To keep it from coming back, experts recommend aiming for slow and steady weight loss. And if it persists, revisit your primary care doctor for the next best steps. Don't forget to submit a health topic to our Ask the Expert series. Go to our website, click the news tab, and look for Ask the Expert. It's simple. More of your questions answered by our Bon Secours St. Francis medical experts after this. Welcome back as we continue to get answers to your various health topics. We continue now with our partners at Bon Secours St. Francis. This is 7 News' Ask the Expert. It's one of the most important muscles in the body, your heart.
It's the main pump that drives our entire body.
And if it's not cared for properly, doctors say you're at risk for what the Centers for Disease Control and Prevention says is the leading cause of death in the country. Heart disease.
Yeah, I'm Andrew de Nazareth, one of the cardiologists with Upstate Cardiology.
Meet Dr. Andrew de Nazareth, a Bon Secours cardiologist, breaking down 7 recommended steps you can take to lower your risk of heart disease.
Heart beats about 100,000 times a day. keep it healthy, makes us all feel great.
According to the CDC, it's important first to know your family history.
So go back and ask them, do they have heart disease at an earlier stage in life, especially a guy before the age of 55 or a woman before the age of 65. If they've had heart attacks before that, we need to know. That's important.
Medical professionals say your diet and movement also play a vital role in your heart health. That includes limiting caffeine, sugary beverages, alcohol, and processed foods. And doctors say exercise should be a priority.
The American College of Cardiology, we recommend 150 minutes of active movement a week. So that's, you can divide it into 30 minutes, 5 days a week.
Doctors say smoking and chewing tobacco are also harmful. One of the 7 steps to decrease your chances of heart disease is to cut out tobacco completely. Experts also recommend staying consistent with your medications.
Take your meds as directed. So if you have meds to decrease the risk factors for your heart, whether it's diabetes or cholesterol or any of that, to take them as directed.
Finally, doctors recommend monitoring your heart and other factors that play a role in your overall health.
The 7th one that's important is monitoring our heart health. Most importantly, blood pressure, but also heart rates, our weight, BMI, all of that. So those are the 7 steps.
Clean, separate, cook, and chill. It's 4 of the best food practices outlined by the Centers for Disease Control and Prevention.
It ensures that your food is cooked to a safe internal temperature, as well as making sure you reduce the risk of any type of cross-contamination or cross-contact with both raw meats and ready-to-eat foods, which of course reduces our risk of foodborne illness.
Bon Secours clinical nutritionist Lauren Hill says it only takes about 15 to 30 minutes for harmful bacteria to grow on food if it's not cared for properly. And if it's consumed, experts say it could cause nausea, vomiting, or GI discomfort.
Ingesting certain bacteria can be deadly if they fall within that danger zone.
There are ways to prevent bacteria growth. Nutritionists say to first clean and sanitize all surfaces.
In order to reduce the risk of foodborne illness, wash our hands when handling raw meats.
That's also the case when handling poultry and seafood too. Experts advise separating foods to avoid cross-contamination.
And then of course not using the same type of cutting board or utensils with our raw and ready-to-eat foods.
Next, keep an eye on food temperature. Hill says it's important to make sure food is not left out for too long and gets thoroughly cooked.
It's very important to cook meat to a certain temperature because there's natural toxins within our raw meats. So cooking foods to a safe internal temperature will ensure that you do kill off those toxins. And an easy way to do that is a meat thermometer.
And finally, if you plan to save leftovers for another time, do so properly.
A great umbrella time is about 3 to 4 days.
Travel is certainly good for your brain.
Whether you're leaving by train, plane, or automobile, time away from home, nurse practitioner Karen Cooper says, has its perks.
Your brain is actually being pushed out of its comfort zone, and this is how travel is good for your brain. It grows. Also, I just want to mention that travel has been shown in many studies to increase productivity, creativity, and life satisfaction overall.
Cooper says you don't have to travel far to reap the benefits.
So research has shown that short or long, whether it's a vacation or a staycation, the benefits to our mental health are many. So no matter what, whether it's your 3-day weekend, as you said, or an extended 3-week international trip, decrease stress levels, increase productivity once we get back to work, and increased life satisfaction overall has shown to happen with any and all.
When planning to get away, Cooper says consider these things to make it a stress-free, enjoyable experience.
Always allow extra time when you're traveling, way more than you think you're going to need. Secondly, one thing that is recommended is that you bring something with you on your travels that brings you some kind of relaxation, happiness, joy. Maybe it's your favorite book that you've been meaning to read. Maybe it's this podcast that you really want to hear. Drink plenty of water. Be mindful of too much alcohol and too much caffeine. It'll throw you for a loop.
If you don't have the time off from work or the finances to take a trip right now, Cooper recommends trying something new as a way to break out of your day-to-day rut.
Some people will take a different route to work. Other people will listen to a different kind of music, a different podcast. They will sit somewhere else for lunch or go somewhere else for lunch. Take up a new hobby. On the weekend, they will make a point to do something completely different instead of what they usually did.
That's a wrap on this week's Ask the Expert show here on WSPA Plus. Join us every Thursday on 7 News as we seek answers to your top health questions, and each week right here on WSPA Plus. For now, thank you for making an appointment with us today.